In March 2006, in a small hospital outside Glasgow, a woman walked into the emergency room. She was calm, too calm. Her arm was broken, not cracked, broken completely. She didn't scream, she didn't cry, she didn't even look surprised. When the nurse asked, "On a scale from 1 to 10, how much pain are you in?" the woman smiled and said, 0. At first, doctors thought it was shock. They had seen it before. Adrenaline can hide pain. This looked normal. Her name was Sarah, 34 years old. No medical history, no medications, no trauma. She said she slipped on the stairs, heard a crack, felt pressure, but no pain. Hours passed, then days, still nothing. No painkillers, no complaints, no discomfort. When doctors asked about her childhood, Sarah hesitated, then laughed. She said she was always getting hurt, cuts, burns, broken fingers. She never cried. Her parents thought she was brave, too brave. By the age of 10, she had already lost 2 teeth, not from cavities, from biting her own tongue. She didn't feel it. The scans came back normal. No nerve damage, no spinal injury, no explanation. That's when the questions changed. Doctors stopped asking what happened. They started asking what was missing. Pain isn't just suffering. Pain is information. It tells you when to stop, when to pull away, when something is wrong. Sarah never had that warning system. She once walked on a fractured ankle. For 3 days, she thought it was stiffness. Another time, she burned her hand on a stove. She noticed the smell before the injury. Doctors finally gave it a name. Not a cure, not a treatment, just a name. Congenital insensitivity to pain. She was born without the ability to feel pain. People think this is a gift. They are wrong. Pain teaches fear, and fear keeps you alive. Sarah lives with alarms everywhere, timers, mirrors, medical checklists. She inspects her body every night, looking for injuries she never felt. Doctors can protect her bones. They can monitor her organs, but they can't replace instinct. Sarah knows something most of us forget. Pain is not the enemy. It is the messenger. Without it, the body becomes silent, and silence can be deadly. The question is, what happens when something goes wrong and the alarm never sounds? After the diagnosis, nothing became easier. It became structured. Every day was planned, not for productivity, for survival. Sarah learned to scan her body visually. Bruises, cuts, swelling, anything unusual. Pain used to do that job. Now she had to replace it with attention. One winter morning, she noticed blood on the kitchen floor. Not a lot, just drops. She followed them back to her foot. A deep cut. Glass. She didn't remember stepping on it. There was no moment, no warning, just damage. People didn't understand. Some were jealous. "You're lucky," they said. "No pain." Sarah never argued. Explaining took too long. Pain is immediate. Its absence is complicated and invisible. Fear didn't disappear. It moved. She wasn't afraid of pain. She was afraid of silence, of injuries she couldn't feel, of infections she wouldn't notice, of limits she couldn't sense. Every quiet day felt uncertain. There is no cure. Doctors can only manage risk. Education, routine, monitoring. Pain can't be taught. It can only be missed. Every year, patients like Sarah face injuries that arrive late, sometimes too late. Pain protects us, even when it hurts, even when we hate it. It draws lines we shouldn't cross. Sarah lives without those lines every day. She walks carefully, not because she feels danger, but because she knows it might already be there.